candidates here that we really appreciate your participation. Again, welcome. This is now just a focus on the House of Representative candidates in districts 13, 14, and 15. And I'm Chris Sundberg. I'm the Executive Director of Elder Voice Family Advocates, and we are an education advocacy organization that is looking to improve the care and the quality standards for those living in long-term care facilities. Um, and as a part of that work, we have been talking with a number of legislators, and a couple of you are fully aware of that. And that's the reason we wanted to have this forum, is to give the area citizens a chance to hear your views and ask. We'll have a little time for some questions at all. So thank you all, you candidates, for joining us. This will be recorded and it'll get posted on our website. Usually it takes about 24 hours to get that done, but occasionally we do better than that. And please feel free to share that recording with anybody you wish to do so with that. I'm going to cut right to the chase here. And unfortunately, we've got to ask each candidate to only give 5 minutes introduction about who they are, and then respond to those 4 questions, which were your views on improving the care in senior living facilities, reducing abuse, neglect, and exploitation, addressing staffing challenges, and then providing for livable wages for staff. I'm going to start with our 13A candidates, and I'll start with Representative DeMuth. You're on.
Thank you, Christine. Thank you for hosting and inviting us to be a part of this important discussion. It's an honor to be here and to both share and then learn. The care of our loved ones in long-term and senior living is without a doubt one of the priorities for all of us, and how important that is. Again, I'm Representative Lisa Demuth, and I'm representing District 13A, which includes the communities of Avon, Cold Spring, Eden Valley, Kimball, Paynesville, Richmond, the Stearns County portion of Eden Valley, Cold Spring, Rockville, Richmond, and St. Joe, a number of those surrounding townships around the area. So without a doubt, it is an honor. I am in my freshman term, and just finishing that up and also seeking re-election. As far as the questions that you have posed, and I appreciate that, the work that I've done in the legislature at this point has been in the areas of early childhood, education finance, Greater Minnesota jobs, and then a number of task force appointments. This area specifically touches on the area of education, and then also Greater Minnesota jobs. And so we know that staffing has been a challenge for the people working in long-term care. And without a doubt, I know that our students coming through the program need to be exposed to career choices, maybe not just traditional four-year colleges or universities, but everything that's available to them. And so I am a proponent of allowing our students in the high school age to be able to explore different career options, get training, maybe some post-secondary training while they're still in school, which then is of course going to be a benefit in the staffing challenges that you faced. As far as improving care, we need to make sure that we are keeping our loved ones and those in long-term care as safe as possible. We also know that unfortunately COVID-19 and the pandemic has been devastating for this population, both in disease and unfortunate death, but also in the separation from families and loved ones. And we all know that when we have our eyes on our loved ones, we know them best. We know maybe when something's not quite right, but if we aren't allowed to have conversation, be in the same place and have eyes on them, there have been and there may be some things are missed. And it's heart-wrenching for our older population that maybe doesn't understand what's going on, and then also for us being separated. And so that's an area that we need. I know steps have been made, but even where there is larger outbreaks of disease, we need to keep that in mind to make sure that the mental health is the most important thing that we are keeping in mind, making sure our people are connected with us. So I think that's one specific current day area that we can really improve that care. That leads into reducing the amount of abuse and neglect. Those that are working in our facilities, I believe, have the best interests in mind. But as we've talked about staffing, when you are overwhelmed, patients get short, things get missed, mistakes can be made. And so in order to reduce abuse and neglect, we need to make sure, as I talked earlier, that our staffing is where it needs to be to provide the best care. And in order to do that, as I've already mentioned, maybe some of those post-secondary or technical college options for our young people or those that are looking for a different career. That needs to provide a livable wage, and that needs to provide where people can provide for themselves. That flows all the way down into the housing within our communities that is offered. We know if our communities have affordable workforce housing, it allows people to establish residency and embed themselves within a community and have that sense of ownership, which then is a benefit in their place of employment. And so that's another maybe unexpected area of the livable wage, making sure that our communities are coming alongside our facilities that are located there to make sure that it's the best place for those people to settle. That's kind of an overarching overview. I hope that was within the time frame. But again, Christine, thank you. Thank you for allowing me to be here and to share on that. And I would welcome questions as we move forward.
Thank you very much, Representative, and especially for staying within that tight timeline. I'll now turn it over to the opponent, and that's Katie Westland. Katie, the floor is yours. Katie, you need to unmute. Can you unmute? There we go.
Yes.
There
Okay.
we go.
Could you go over the 4 questions that you had outlined before?
Just go ahead, introduce yourself while you're running, and then the 4 questions are: what are your views on improving care in senior living facilities, reducing abuse, neglect, and exploitation, addressing staffing challenges, and providing livable wages for staff?
Take a note so I don't forget what I'm talking about. So, so my name's Katie Westland, and I'm running for 13A. And my big focus is working for the families, the farmers, and the small businesses in our communities. And so I'm running because there is a huge amount of things that we are going to need to take care of to fix from the previous administration and the previous representatives that are supposed to be representing us now. And there's just so much to do. One of the things that I want to do for improving care is at a high school level, that I want to make certification programs available so that juniors and seniors can actually get the certifications that they need at high school to be our CNAs, our TNAs, and in those beginning levels of care fields. We need to make sure that reduce abuse and neglect, specifically by making sure that we have enough staff. There needs to be enough staff on, oh, sorry, somebody's handing me stuff. Thank you. Through the window. I'm taking my phone call in the car from another meeting, so I'm a little stuff's going on. So multitasking. So my mom, we need to make sure that we have a moral backbone in making sure that we take care of our most vulnerable populations. And one of those vulnerable populations is people in our nursing facilities, nursing care facilities, and assisted livings. My mom is in assisted living. I wanted to put her closer to me in Painesville, but there just was not any available options. And so in our rural communities, what we need to do is make sure that we have facilities that are available for families to stay close to their loved ones, to absorb the people that live in our community so that they don't have to be shipped off to St. Cloud or another city. They need to stay in their hometown if that's what they so choose to do. And so in order to facilitate that, we need to make sure that we have building more facilities, making sure that we have enough staff that are skilled and know how to deal with those with the issues within those living situations. For my mom and her being in assisted living, it's really scary. It is terrifying when you have to leave your loved one in a facility and hope and pray that they're going to be taken care of, and that the people that are working there are going to have enough time to do the care that they need to do, that they're skilled enough to do their job, and that they're paid well enough so that they can provide for their families. And what we need policy wise is to make sure that there is licensing for these facilities, because they are taking care of our loved ones. They need to be held accountable for the dangers that they put our loved ones in. They need to be investigated much more freely than what they are now. We should have somebody, maybe it's an entire group staff, and I'm new to this whole politician thing, but we need to have an entity in the state that can go and investigate issues, and they should be able to walk into any facility right off the bat and observe whatever they need to observe, because that's how we stay accountable. What has happened recently with COVID-19 and family members not being allowed to go into the facilities, other than minimal phone calls and contact, if you have a loved one that has limited funds and they don't have access to get an iPad or something to that effect, you have no idea what's going on in there. And that's not okay. We need to make sure that family members have access to their family members. That's super important. And we need to make sure that the facilities have the funds needed to make sure that they have the PPE and the processes that they need. My mom is over at an assisted living. I don't know why I'm having, the Sanctuary of St. Cloud. And they have a really great protocol about masks and all of those safety procedures in place. And they need help with that. They need the funding. They need to be fully compensated so that they can do the job that they need to do. And I guess that's it. So,
well, thank you very much, Katie.
Yes.
And thank you for that tight timeline. I know it's tough. I'll move right along to 13B. Representative O'Driscoll was not able to participate, but his opponent, Benjamin Carrillo, you are on.
Yeah, so ultimately, I think when it comes to senior living, one of the issues that exists is structural. Because even if a lot of senior living facilities are nonprofits, we do need to recognize that there are a lot of nonprofits that are out to make a profit, right? And that's one thing that we need to acknowledge, which is why one thing that I think would make a huge difference in terms of real structural change that would fundamentally address all of the issues of quality of care and wages for the employees is basically creating an option, right, and making available funds from like revenue bonds in order to allow people living in like assisted living facilities and senior living facilities to basically purchase the facilities as and run it as a cooperative. So that way they would actually have direct democratic control over the entire structure and system themselves. And so if there's ever an issue with abusive staff or anything like that, they would quite literally be directly in control of being able to make sure that those people are removed. It also incentivizes developing nice, positive, long-term relationships between the staff and the people living in those facilities. And really it would be, you know, to everyone's benefit for those employees to be paid well, and they would probably have better conditions, right? Because another result of the sort of profit-driven model is the fact that there is constantly this pressure to push wages down and to reduce costs. And ultimately that leads to a lot of turnover. I mean, I know a lot of people who've lived in a variety of assisted living facilities. And unfortunately, one reality that exists is there's a lot of turnover because a lot of the people working in the facilities, they're just, you know, overworked and underpaid. Meanwhile, their managers and the executives in the company are making tons of money and, you know, sort of not really doing the real work on the ground that makes a big difference. And so putting in place some sort of structural change like that, like allowing them to basically form cooperatives so that the people living in the facility are actually the ones running it, would make a huge, huge difference, because it would really incentivize, you know, putting the money towards the people who actually make it a better place to live, right? You know, everybody, right, in their senior years wants to be able to live a comfortable life and be able to know that they can enjoy their time and really, you know, take in those golden years, right, that we all look forward to in retirement, right? And so giving them control over their own conditions of living, I think is one of the most powerful things you can do. And I put my intro at the end of this because I didn't know how long that explanation would take, but my name is Ben Carollo. I'm an Air Force veteran. I'm actually finishing my master's degree in biosecurity and biodefense. And one of the things I really want to touch on is actually something I spent a lot of time working on about a year ago when I was writing this really long paper, you know, for my master's degree. And it was all about all of the assumptions that exist, within different emergency response plans. And one unfortunate reality that I saw when I was analyzing you know, emergency response plan from cities and counties across the country is, you know, I found a real shortage of understanding when it comes to people who have specific needs, who might not have a car of their own, who might not have mobility of their own, who might struggle with some type of disability. And so when disaster strikes, people tend to think, you know, people tend to think in relatively ableist and ageist terms, where they assume that everybody is a young family that can get in a car and run away, or everybody can just go to the grocery store and stock up on goods and stay home. And it's a really unfortunate assumption that is built in to a lot of the disaster response planning across the country. And one of the reasons why I, you know, want to be your representative is specifically because I will take in mind all of the people that are very often forgotten in plans like that, and make sure that anytime any disaster like this strikes again, that the people who need the care the most are the ones that are definitely taken care of first.
Thank you very much, Benjamin. Again, I appreciate your being succinct, and I'll move right on to 14A and ask Representative Tamara Tice, please, you've got the floor, and thank you for joining us.
Thank you, Christine. It's nice to be here today. Man, that's a lot to say, but I'll try. My name is Tamara Tice. I represent 14A, which is the west and south part of St. Cloud, Lake Park, St. Augusta. And I am very honored to have served on the first Aging and Long-Term Care Committee. And then the second year I was vice chair of the committee. And then this past year I hadn't had a chance to be on the committee because there were only 2 chairs available and I didn't make the cut. So that being said, I still kept very close contact to it. So when I look at here, how to improve care, I think one of the things we need to do, and we saw it happen quite a bit, is we need to have the agency, the Department of Health, really step up their game on when they get complaints, when they get concerns, that they're following through on that. We found out they weren't. And we need to really make sure that they have systems in place that they can do this in a quick turnaround instead of having it go forever and ever and ever. I also know that the Department of Health wants to back up the implementation date of the licensing of homes, and that can't happen. I mean, we've been waiting for this for a while, so for that to even be a possibility is long. I mean, I'm certainly not going to say that's okay. We need to keep it in place as what it had been. I know that we also passed a lot of the elder protection bill, which is allowing for electronic monitoring, protection against retaliation. I think that is a big deal. And then when we look at report abuse, neglect, and exploitation, I think, again, we need to make sure that the Department of Health is doing their part in getting these concerns turned around in a quickly manner so that we can address them, so that we can figure out what do we need to put in place differently, what is working, what isn't working. But I think it really lends to that. I think telemedicine has also been a really good deal, and maybe for providers to know that, you know, there is something going on, that they're not seeing the person respond the way they think they should. And addressing staffing challenges, man, that's a whole day. One of the things that I learned out quickly was that nurses no longer have a prereq of being a CNA. I think that's a really good part of what needs to happen. CNAs have been around forever in the high schools. A lot of my friends worked as a CNA at either Cold Spring or Watkins, where I grew up, or Kimball. And some of them still use that today. Some of them are still doing some of those things today, but they've also gone in the nursing field. And I feel it's really important for nursing students to know that this is a part of it. This is what can happen as well. My niece just recently went through and became a nurse, and she started out as a CNA. I think that's a really great place for us to start. And we've kind of lost that a little bit. But also, I think what we need to do is, we started out with making sure that we had nursing homes funded in a much better way, a way that works, but we never got to finish that. We never got to making sure that staffing in the other areas were where they should be. And I didn't see that happening so much this past year. And it's going to be really tough in the coming year because of the deficit we're going to be facing. Do know that it's on my radar, and that I will be asking a lot of questions about that and making sure that, you know, we look at how do we keep our folks that are working, our staff. One of the times that I was going through the nursing homes, I heard it every one that we visited, but this one gentleman especially, I'll never forget him. He wheeled up to us and said, "Quit making me train these people how to take care of me. I'm sick and tired of them. I'm tired of doing this job. Pay them more so that we can do it." We have to make that a priority and do it. I mean, our PCAs, our folks that are working on assisted living, nursing homes, they really need to be taken care of. It's God's work, and heaven knows I would have a hard time doing it. We also need to make sure that we look at the mental health of the folks that are in our facilities. My uncle is just in the senior living part in Watkins, and it's been really traumatic for him. He's 89, very healthy, but I gotta say that we're really worried about him because of the isolation. I think it's really damaging to a lot of folks. So I'm hoping that we could do a little bit more. He is now able to go see, or my mom is able to go up to see him. So they're 89 and 83. And I never thought, you know, at this age, I would have to worry about how often my mom sees her brother. But it really is a deal. It really is affecting how they relate. My uncle wouldn't even go to their sister's funeral because he would have had to quarantine in his studio apartment for 2 weeks. And he's like, I can't do that. I just can't do that. So now mom and dad are able to take their side-by-side, their four-wheel thing up there, and they pull behind by the garden area, and then Merlin will come out, but then so will about 3 or 4 other people to visit, and they're all folks mom and dad have known for years and years and years. We need to figure out how we can do this a little bit better. Our elders need us. they need us especially now. And it's about time we figure out how we can better take care of them. And thanks again for the opportunity. And I know I'll be seeing you. Thanks.
Yes, I can guarantee that. Thank you very much, Representative. I will turn it over to Tamara Calhoun. Tamara, you've got the floor.
Yes, hi. Thank you again for inviting all of us here. This is a great opportunity to be able to speak to this. My background is a music teacher. I taught for 34 years in the St. Cloud Public School System and retired 5 years ago, and also have been a leader with GRIP Isaiah for 17 years, but for the last 5 years have been able to put more time into that, working on the North Star train and education funding, lobbying down at the Capitol. And I've also worked on the St. Cloud Policing Agreement and the Sheriff's Community Sheriff's Agreement too in Stearns County. So those are some of the things that I've been doing as a teacher and as a member and leader of Isaiah. And all of that prepares me in that I listen very well. And then I research. And from that research, then I plan and then I do. So that is what I've done my whole career and through Isaiah as well. So will continue to do that in the legislature. So your questions are all very good and they're all very related. So first I would be sure to ramp up testing and be sure that all the protective equipment is there, the personal protective equipment. Once we know that that supply is high, then we can rest assured that that part of the nursing homes are taken care of, that we've got the testing and the people taking care of our loved ones are protected. So that's first. Second would be investing in that job training. We have many people that are looking for different work. And if we can invest in that job training and again, you put $1 in at the beginning and you'll get, $9, $10 on the return of that investment. So that's an important part of investing in workers and training them with that. And then third, with that training, then we should increase the pay to a livable wage. As many have said already, you're going to get good people to stay there and work there if they have that livable wage. Most people like doing that caring, and you're going to attract people that already want to take care of others. So that's already taken care of just in the people that you attract. But to keep them there, they have to have that livable wage to support themselves and keep going with that. So that would be third. And then fourth is that in line with that is the higher quality of employee. Once you've got the training and the livable wage, then they should be licensed, and bringing in that higher quality of employee that is working on our elderly, and that they be accountable, that there are accountability measures on how is their care, how are they taking care of our elderly, and so that our elderly are not teaching them, but they already know they're competent when they come in with that. And then five, I think the pandemic has allowed us to do a reset button to really think of all of our systems, healthcare, elderly care, education, transportation, everything, and put all of it on the table and brainstorm, what is really going to be the best way that we can deliver these systems and this care to people. And so by hitting that reset button and thinking of all sorts of new options out there, I've read articles that suggest college students could be housed with elderly in some of the nursing homes and assisted living. And then they're being helped with their own housing, but also they can partner with the elderly and give just that feedback, that camaraderie. I think that's just a wonderful idea of partnering housing with college students in that area. And also a possibility of the senior citizens education program. I mean, bringing in more possibilities for senior citizens and the elderly in education. There are programs through the University of Minnesota and many of our colleges for continuing the education. I mean, the boomer generation, they're not ready to stop learning. They're not ready to necessarily stop working, so that there are programs that we could think of that could connect that generation, which I'm part of actually, but connect that generation with still educational opportunities or other work opportunities, like a Boomer Corps was one article I read, kind of like the Peace Corps. So some options there on the reset button for elderly.
Thank you very much, Tamara. I appreciate those comments. Let's now move on to District 14B, and I'll ask Representative Dan Wolgamott to present your case here. Thank you, Dan.
Absolutely. Well, thanks again to everyone for taking the time to participate in this really important conversation. Every Minnesotan deserves to live their retirement years with peace and safety and prosperity. And that's why it's been really heartbreaking to hear stories where, facilities and have missed the mark. And, we've had some really bad, really painful, really tragic situations. And so that's why one of the things I'm the most proud of that we accomplished this past biennium is working closely with the broad coalition of advocates, including, of course, Elder Voice Family Advocates, as well as AARP Minnesota, the Elder Justice Center, Alzheimer's Association, and Minnesota Legal Aid, collaborating with care providers to pass some really long overdue forms. And that elder care law that we passed created a licensure framework for assisted living facilities. It made more streamlined enforcement of care standards, enhanced rights, including, I think, like Representative Tice mentioned, the use of electronic monitoring for older and vulnerable adults and their families. Before this became law, it was kind of shocking to hear that Minnesota was one of the only states in the nation that did license and regulate assisted living facilities. That's unacceptable, and I'm really proud of the work that we did to make those reforms. Another issue is updating the disability waiver rate system. Right now, there's a significant workforce shortage with direct care workers. And to make matters worse, back in 2017, federal policymakers really upended Minnesota's system that determines how much direct care staff are paid within the disability waiver rate system. Advocates and folks kind of commonly refer to this as the 7% cut. So this past session, we took action. We implemented a competitive workforce factor to address the current workforce shortages and funding inequities. So this new factor adds over $34 million for the upcoming biennium for wages, resulting in an additional 4.7% rate increase to improve how wages are calculated. And make them kind of more accurate and more fair. So all these changes were made to improve wages for direct care staff and help address this current workforce shortage. Obviously, there's so much more work that needs to be done and building off of that. But again, I'm proud that we were able to take some action and address this problem. Another thing we did was we expanded the long-term care ombudsman's office. After decades of being understaffed, we committed to increasing the number of long-term care ombudsmen working in Minnesota under our elder care law. This is one of the most tangible solutions to protecting Minnesotans in long-term care. And really kind of how it works with the additional staff, there will be more independent investigators to receive complaints and take action to remedy the complaints, as long, of course, as they're justified. And once our Elder Care Act is fully implemented, 17 additional staffers will be able to help ensure that this new law is being followed. So it's one thing to pass a law, but we also want to have some teeth to it and some enforcement. That's what those additional staff will do. We want to make sure that the law is being followed so we can protect those who are living in nursing homes, receiving home care, living in assisted living facilities, foster care, or customized living. And one last thing I want to touch on is, again, of course, how the coronavirus pandemic is wreaking havoc on the lives of our elderly who are in long-term care facilities. But it's so important that we take action to protect the residents and care providers. So I'm really proud to support Governor Tim Walz has a 5-point plan to address this situation. It includes expanded testing, enhanced support for infection prevention, providing masks and other personal protective equipment when the supplies are in short, and ensuring adequate staffing even as facilities face significant numbers of COVID-19 cases among residents and staff. We've got to make sure that we're giving these facilities our full attention, and the heroes who work in these facilities, and of course, most important, the Minnesotans who are residing in these facilities. So again, proud of the work that we did. Clearly, there's so much more work that needs to be done. And now more than ever, we're seeing how important it is that we invest time and resources and thoughtfulness into these facilities and the people who work there and the people who live there. So thanks again. Looking forward to furthering this conversation while we're on today. But of course, as we get through the election and back into session, I'm excited to partner with everyone on this call to make sure that all Minnesota seniors get the long-term care that they deserve.
Thank you very much, Representative. I'll now ask Paul Brandemir, the opponent in 14B. You have the floor, Paul.
Hi, good afternoon to everybody. Thanks for inviting us in here. Like you said, I'm Paul Brandmeyer, and I'm running for 14B against Dan Wolgamut, whom you just heard from. The reason, people say, hey, Paul, why are you become a politician? I said, well, I'm not a politician. I'm just a citizen who's tired of what's going on and decided to get involved. Big difference, because even before I ran and I told Dan I was going to run, I said, I'm not running against you, Dan. I'm running for the office. So it's a big difference in kind of how I look at things. My background is I enlisted in the military right after high school and did serve 21 years in the Air Force. During that time, I was in law enforcement and counterterrorism primarily, and then I was working in command and control as a nuclear missile launch officer for a while. And I ended up as a commandant of 11 technical training schools at Keesler Air Force Base down in Mississippi. And then I retired and got into retail, decided retail wasn't my thing. So I ended up kind of drifting a little bit, taught driver's ed to the youth. I drove school bus, and now I'm driving semi. Kind of like being alone with my thoughts and so forth. Elderly care is kind of near and dear to my heart as well. In fact, it was one of the reasons I got involved in the first place. Being in my 60s now, I'm fast approaching that age where I'm looking at things. We recently put my mom into a facility as well out in Washington State. She suffered a triple bypass 2 years ago, I guess, and that was kind of the end of that. My little brother moved her into a facility very close to where he lives, so he checks on her every day. So we have the advantage of him living so close. He's able to stop in and check on her. So even in the COVID, she's able to see him and his children and my nieces and nephews and so forth. So it's worked out really well. When I was a Cub Scout leader, one of the things I like to do was in my pack meetings for November, December timeframe, we would make homemade cards, and then the kids would go up to the VA and we would hand out the Christmas cards. These little 6, 7, and 8-year-olds handing out Christmas cards to the elderly. And I was told then at that time, and I did it year after year after year, that a lot of times those little guys were the only visitors that some of these elderly folks got during the Christmas time period, and that struck my heart. So I made it a point to continue to do that year after year and to make this an issue. In preparation for my candidacy, as well as a city councilman, and then more so as coming up for this interview today, I did have the opportunity to talk to a former VA employee in the extended care, also a former current Telahi administrator, a former St. Ben's employee, a current resident at one of the facilities, and also a current CNA out at Good Shepherd. Sorry. My wife actually works in extended care. My daughter's a PCA. One of my sons was a CNA, so it's kind of near and dear to my heart. Now, as far as personal visits and so forth, I think is so important, as several of the other people have already discussed. The coronavirus has really wreaked havoc on the humanity of being able to touch and to hug and to smile and to see people, because you got shields and masks and face shields and so forth, and plexiglass and all this. So one of the things I think is important is if we can have somebody, a family member that's a dedicated individual that can go through the protocols and so forth, the trainings, get the the protective equipment and so forth, and be that personal care person that come in once a week or something. Just say, "Mom, Dad, how you doing?" Whatever, bring them their favorite, candy bars or whatever. Uh-oh, what happened? Are you there? Hello, are you there?
Oh, okay. Yes.
Yeah.
Sorry, Paul.
Okay. Well, I was talking about having a family member or so forth that might be designated and receive training and equipment and so forth to be able to go in and look in on their loved one once a week and bring them their favorite items, and so forth. But just to get some of that personal touch and so forth. One of the things too to address staffing issues is I'm being told that there's far too much middle management, and so much of the middle management does essentially 90% of their time is spent going to meetings. The meetings are important, coordination is important, but it seems to me that you need less middle management and more increase in the end of the aides, the CNAs, the people who actually do the grunt work down on the ground. So if we were to because I'm a business major, I got a master's in business, and the thing that we need to do is not say this is what we would like to do. You got to figure out a way to pay for it too. If we were to cut the higher paid middle managers and increase the amount of people that actually have hands-on to the patients, it would pay for itself in that regard. We also need to increase training. A couple of the people that discussed, Lisa and Katie talked about increasing the training and expectations and so forth, maybe start at a high school level. But again, with my military background, a lot of our people that come out of corpsmen and so forth, out of the military medical field, they're not even certified. That's one thing that I would try to change as a representative. I'd try to get our certifications for our military people that are coming out of the service. One of the things that needs to be done is to emphasize the respect for the residents. So many times I've heard horror stories of staff that it's a job to them. They don't have that professionalism that's required to actually deal with and compassion with these people. They go, they do their work, and they go home. Well, there's a lot more to it than that. These are human beings. They're not just warehouse people that are, bedridden and so forth. So there needs to be some training and higher expectations for a respect of the people that are our mothers and fathers and grandparents that are in these facilities. The supervisors that we do have need to have more patient contact, less meetings, more patient contact. Work with the CNAs, work with the LPNs and so forth. They're actually doing the changing of the depends and the bathing and the nail clipping and those essential things that our CNAs are doing to make people feel more human. We need to try to read my notes here. I can't read my own writing.
Yeah, Paul, if we could wrap it up fairly quickly. Thank you, Paul.
Certainly, yeah. We need to encourage more of the residents to take care of themselves. I think that's more of a self-esteem issue as much as anything else. It would also cut down as much of what needs to be done by the aides. Again, I'll just try and summarize here. There needs to be more supervision. I'm thinking that if we have a CNA aide supervisor of the other CNAs and so forth, rather than have them supervised by a nurse, they should be able to supervise themselves. That way they can kind of have a more of a team aspect of it, and a promotion aspect, to be able to bring them up to a higher pay and more responsibility, give them more self-esteem as well. It might be a way to get people to be more responsible for their own needs and their own career paths. Like I say, you go ahead and wrap it up, then move on to the next person. But yeah, I've got a lot of ideas and so forth. But it's really a matter of taking pride in what you're doing, being paid for what you're doing adequately, getting good benefits. And if you do that, you'll have more of a draw to bring people in to do the job. Thank you.
Thank you very much. I'll move right on to 15A, and Representative Sandra Erickson, you're on.
So I'm unmuted, is that right?
Now you're live. Go for it.
Thank you. I am Sandra Erickson, and I represent 15A, which is all of Mille Lacs County, half of Kanabec County, and 2 townships in Sherburne County, Baldwin and Blue Hill. We're an interesting area because we're somewhat suburban, we're farming, and we're tourist. So, you know, my constituency looks for all different varieties of elder care as they grow older. I think we've heard many good ideas this afternoon, and I thank you for having this opportunity to express some of our ideas. My emphasis in the legislature has been in K-12 education, in policy, finance, but I've also served on taxes, health and human services, regulated industries, and more, and also am a member of the Legislative Audit Commission, and we have looked at nursing care over the years that we've done or had the auditors do audits. So I'm very proud of the work that Senator Karen Housley accomplished. She really was a leader in the legislature for bringing about elder care reform, and that's going to really make a difference. But we can improve care, of course, through more training. Certainly, I support the CNA training and classes offered at the high school level, and Malacca High School does that presently, even during the virus. They offer that course, and you know, the young people there in the facility that has been provided for them between Elam Home in Malacca and Malacca High School really gives them a firsthand opportunity to learn what it's like to care for their loved ones. Many of them have grandmas and grandpas in the Elam Home or in Country Meadows or in Sterling Point in Princeton or the Cayley House or some of the other facilities that exist in Onamia and Isle and Mora in my area. So training is important, and our young people see that importance as they are training. But they will find, I'm sure, because this is exciting to them now, as they get into the field, this is very difficult work. And I spend a lot of time in Sterling Point here in Princeton, and I know how hard the staff have to work, because the one thing that happens to us as we grow older and have to give up our independent living is that we're subject to others' requests and demands. And that's hard on our psyche, it's hard on our mental health. And so it just takes special individuals to be able to endure all of that comes from the residents as well as from fellow staff members. So expanding training to cover mental health, to cover all the anomalies of growing older is important. Also, my friends tell me that, you know, they're looking for, this is my friends who have loved ones in care facilities. They say we're looking for something different. So I'm hoping that the private sector can step up and begin looking at housing grants to provide more transitional housing. Because I think in this day and age, when we're staying healthier as we grow older, we need more of that transition to our final time probably in a nursing center. So I want to encourage at the legislature, when we're talking about housing, incentivizing the private sector to get into the business of building facilities that can be independent living in our smaller communities and in our larger communities, to prepare us better for that time when we're going to be more subject to the wishes of the regulated industries that we have in nursing care. To reduce abuse, I think Senator Housley's reform was excellent in that way, because it brought such great attention to what has happened to some of our loved ones in their facilities. My mother navigated through the nursing care from assisted living to critical care over a 15-year period and paid her own way. So that cost her a good $1 million. But what we noticed as family was that it's really important that the family engage with the staff, and that if certain provisions that are provided for your loved one do not meet your standard, that you communicate that. Staffing, of course, is always an issue, but a lot of the staffing is based on reimbursement that comes from the government. And so that's an area where we need some work and some reform as well. I certainly want our nursing homes to be reimbursed to the ability that they qualify. Some are on Medicaid, some are on other programs of assistance, some are private pay, as my mother was, but But, you know, we have to ensure that our staffing is well educated and that they also know that we value them so much that they are going to be reimbursed through anything we have available at the state level or private. And then the livable wage, we always want our staffs to be earning what they should be valued at. And how that comes about in this coming biennium, I don't know. That's going to be very difficult with a projected budget shortfall. But I know that we'll put our heads together and we'll try to think of ways that we can ensure that our loved ones, and we're all going to be in that stage of life someday, are cared for at the best of their ability, that any state policy that is enacted is going to support them as a family, is going to support their faith if they are faith-based, and we want to encourage that. And we also want them to know that even though these are highly regulated care centers, that we want them to feel the freedoms that they have as American citizens and as our loved ones here in Minnesota. So that's kind of a broad overview of what I see, because so many of the specific ideas have been mentioned, and I support many of them and hope to continue to work on this issue. Thank you.
Thank you very much, Representative. I'm going to move on to 15B. I'm not sure, did Representative Shane Meeklin, are you on? I don't believe so. I know it was a little iffy. Let's then conclude with Ron Tyson. If you could proceed, thank you. Okay, well, it looks like we've lost both of those folks. So let's just go to a couple of questions that came in, and I'll let any one of you who wants to respond to that. Ramona has asked, what is the appropriate ratio for care aide to patient? Right now, the ratio is 11 patients to 1 health aide. Any of you want to comment on that?
It's too much.
Anyone?
Yeah, I think ultimately it really depends a lot on the particular facility. And this is one of the reasons why I mentioned earlier the idea of basically restructuring a lot of these facilities as cooperatives. Reason being is if you give the people living there like the democratic control to, like, you know, maintain all the staffing and things like that, then they can decide what ratio works best for them in particular situations. Maybe you have people with higher needs. And so maybe funds go to more staffing. Maybe you have people who have less needs. So you have less staffing and maybe they spend more money on things like, you know, on things like activities and stuff like that. And so ultimately, I really think that the people living in assisted living facilities should have, I think, the final say when it comes to staffing, because what Paul Brandmeier said, I think is 100% correct, that there's too much going right now towards like the middle managers and executives, and not enough to the you know, the actual people who are doing the work, who are you know, working to make people more comfortable.
Thank you. Anybody else want to comment on that, or I'll move to the next question?
Yeah, that's Paul. Yeah, what he was just saying is exactly right.
Paul, can't hear you.
I am unmuted. Can you hear me? No?
Sorry.
How about now?
I can hear him.
Okay, all right, proceed. Maybe it's just me. Go ahead.
Okay. Well, what I was saying is that yeah, my wife just piped in here. She's listening too, and she says, yeah, it really depends on the amount of care that the individuals need. So, yeah, the ratio also told is adequate for generally speaking, and that's all we can talk about is generalities at this point. There needs to be a standard, obviously, but you know, if you get to the point where more, I'm hearing talking, but yeah, if the certain residents need more care, then obviously you need to have a higher staffing. But you know, then it's a matter of, you know, every place you go, they've got signs up says help wanted, and the people just aren't there. So then we go back to we need to recruit more people to go into the field in the first place. And that requires enticements, and that's either pay or benefits or satisfaction of work. So those are the areas that need to be looked at. Thanks.
Okay, thank you very much, Paul. I'll move to the other question here, and this is from Lori. There's a severe lack of subsidized assisted living. How will you address this crisis and invest in more affordable housing with services for older adults? And I know Representative Tice has responded, but anybody else want to comment on that?
So this is Katie Westland in 13A, and our rural communities really need facilities out here. And so what that takes is policy at the state level and working with the communities that need the buildings to start going up. That'll work. That'll be really beneficial for the overall economy because you'll be bringing in well-paying jobs, and if we have the staffing levels, specifically, I'm going to go backwards to that other question. If we have staffing levels based on ratios of need, so obviously, if there is somebody that is bedridden or is in hospice or has a greater level of need, they shouldn't be wrapped up in with 6 other people that have really great needs and then add the other, 5 people to make 11. So it really needs to be a ratio based on need. Once we have high schools running through the certifications and licensure and whatnot, that can fill those needs. And so, yeah, I mean, there's lots of work to be done, but it needs to be done on many levels because it's all intertwined.
Thank you very much. I think I'll move on, and we'll go over for just a little bit here our time and try to take another couple of questions here. Jean is asking, many of, not most of our loved ones, caregivers are unlicensed personnel who are overworked, underpaid, and very often hired at part-time. What would you do to address this? Who would like to take that one on?
I'll talk about that. Again, that's that investing in our people and investing in the job training. And I think that it should be full-time work because so many people, if it's all part-time, then they're not getting the benefits. So we really need to have these as full-time invested employees there with the benefits that follow the full-time worker. And again, if we're investing in training and investing in our people, that return on the investment is huge. So we need to take the money and invest in job training and people. And
Thank you.
full time.
Thank
And
you,
I think
Tamara.
we're
Go
just
ahead.
not finding the people. It's hard when everybody's raising their wages, and when you look at how some of the care facilities are reimbursed, it's very hard to be able to raise the wages to where they should be. And we've been trying to, get as much money as we can dedicated to that, but it's just been very difficult. But truly, it's just been such a struggle to get, especially our younger folks, interested in doing this. And that's why we're trying to do more high school programs where they actually get on the job, so more or less training, so that they get an idea of what this vocation would mean. So we're trying. It hasn't been an easy fix, and you'll see that in so many industries as we just can't get the people excited and in it. So we're going to keep trying.
Thank you, Representative. Go ahead.
I know a lot of people who worked in assisted living, and honestly, I know a lot of people who loved that work, who really actually enjoyed taking care of people. And learning. I mean, honestly, like if you work in an assisted living facility, you're going to learn a lot of things from the people that you're working with. But unfortunately, the conditions that they're working under, as you mentioned in your question, a lot of them are underpaid. They're working part-time, right? Which means that they might not be getting decent like healthcare benefits and things like that. I mean, that really is a serious problem. And so there's this huge rate of burnout that is really the result of the conditions of work that the workers are put into. And I kind of want to tie that into the same issue, where, you know, you've got a lot of money that's going to middle managers and you have a lot of money that's going to like executives, right? When you have the private sector involved, their goal is to make money, right? That is their goal. Even if it's structured as a nonprofit, ultimately they kind of still have that same drive. And if their goal is to make money, that means their goal isn't to care for the people living in those facilities. And that's why I think it's absolutely essential that you give a democratic voice to the people who are actually living in facilities, to give them control over that, because their incentive is going to be the same incentive as the people working in those facilities. They are going to want the people who are making their lives better to be cared for, right? Just like, you know, cared for financially with their wages, as the workers are caring for them personally, as they're struggling with, you know, whatever particular misfortune sort of life has put on them. And so that's really, I think those issues are interconnected, and ultimately it just is because the system is structured in a way that the people living within these facilities aren't given a voice that I think they should have.
Thank you, Benjamin. I'll do one more question that came from Lori, and the comment in question: the Blue Ribbon Commission has been challenged to reduce 100 billion from the HD's budget. How will you ensure needs of older adults and family caregivers are not jeopardized? That's a tough one. Who would like to take that?
Well, I think we need to be strong because one of our largest groups is the baby boomers, and which includes me. And since we're talking about probably the largest group of folks and how do we take care of them, that absolutely should be one of the things we say, you know, we can't go back on this. We have to continue going forward and making sure that we're taking care of them. I'm just reading some of the note. But we need to be very strong in that, you know what, we need to do this because this is our largest group of folks right now. I mean, we're outnumbering kids in school.
No,
I mean,
really
this
not.
was,
No.
are we? It's got to be pretty close because we kept hearing it was going to be now.
In 2030, we will have more older adults and school age children. And also in 2030, the oldest of the baby boomers will turn 85, which is the age when people start to really need services. Okay,
then they were telling us different information because I thought this was going to be the time when we outnumbered. But, you know, it's got to be our priority, and we got to hang in there and just really beat it because it is that important. It's that important to me. And I know it is for many, many others. So we need to be very diligent and stick strong to that one.
Go ahead. Does somebody want to comment? Okay.
So
Well,
I'm going to stick my nose in here.
Okay.
So I have voted Republican and Democrat and Independent and Green Party and Libertarian, and I'm running under the DFL ticket. I should have said this is Katie Westland. I'm running for 13A. And what I've seen on the Republican side is that there is not a movement towards protecting the most vulnerable. It's about getting tax breaks and giving benefits to the wealthiest. And that doesn't work. When we need to all come together and protect our most vulnerable. And you have to have the moral background, or the moral backbone and background, I suppose, to say this is not okay and we need to do better and we need to figure out a different way to do it. And our government is not effective right now, and that needs to change.
All right. Well, with that, I'm going to thank our candidates. Thank you very much for taking time to do this and offering your thoughts for those folks here attending. Again, this will be recorded and it will be on our website. And I will share that link with you when it's ready. And for anybody in the audience as well, please share the link to that for those who are not able to make this. But with that, have a very good day, stay healthy, and thank you very much.
Thank
Bye-bye.
you. Thank you.
Bye-bye.
Bye.
Bye-bye.